dental abscess. There is an abscess at the bottom of the tooth, basically. Now it happens like that is here basically described that there is food rests at the top of a tooth, for example, and when there are bacteria living and they're eating the food and they're creating acids, and then a cavity builds. And when there's a hole in the tooth, and then through that hole, through the enamel and the dentine, there can come some bacterium in through the pulp in the inside of the tooth, down to the bottom where the tooth is standing on, basically in the jawbone, and there now the abscess is formed. And it is filled with pus, dead white blood cells, and digestive tissue, and dead living bacteria, and that is there. And it can be also periodontal at the sides if it's also from food plaque, there, also food rests, basically. And there can come gingivitis, and then there can be also form at the inflamed gum, also such an abscess. If it's there, it might be just scraped away. If it's in the tooth, it can make aching and throbbing and pain on biting and chewing. It can be also become tender, red, and swollen. Now it can then break through a sinus to the surface and forming a gum boil with swelling. It can then also spread. If it does that, there are antibiotics against it also. Then the glands of the side of the face and the neck can become affected. And if it's where the tooth can be extracted, it can be made root canal treatment, so the center of a tooth is taken out, the pulp, and then there is an antibiotic filling made in for a few days and then taken out, then looked if it's all clean now, nothing going on. If yes, there's cement put in and closed and sealed. These are the both treatments, basically. And that's according to the Illustrated Medical Dictionary, written by Stuart Davidson, Penny Preston, and Francis Williams, on the page 6, and some other ones. But this is no substitute for medical knowledge, and also medical advice.